It is called the silent thief of sight, but so many don't know what glaucoma really is. Today, Dr. T. Hunter Newsom and Dr. Vinita Srivastava join us to explain it. Good morning.
Good morning. Thank you for having me.
So yeah, let's dive into this glaucoma, because it's one of those terms we hear it a lot, but I don't know if we necessarily know exactly what it is. Unfortunately, a lot of people dealing with this. How do you explain what it is, Dr. S?
Yeah, absolutely. Actually, glaucoma is the second leading cause of blindness worldwide and is the top 3 cause of blindness here at home. It affects the optic nerve, which is the cable that connects the eyeball to the brain. It's usually caused by high eye pressure, but people with normal eye pressure can have glaucoma as well.
Is it painful?
There are no symptoms with glaucoma.
So what does it do? What's the issue then with it?
It causes damage that takes away your peripheral vision first, which is why people don't notice that anything's going on, which is why we call it the silent thief of sight. It's only when it starts to affect your central vision, that's when people notice that something's going on, and by then it's too late.
Too late, oh no. All right, so then how do we get ahead of this? How do we notice it sooner?
So unfortunately, there's no cure. So the most important thing is getting the regular eye exams, preventative eye exams, absolutely.
Is there something in particular during these eye exams that should be done? I feel like you can opt out of some things. I don't know, I want to make sure I'm not doing that.
Yeah, absolutely. Getting your pressure checked.
Okay.
And having your optic nerve looked at.
And anybody in particular who's maybe more of at a higher risk? I don't know if it's age or gender or...
Absolutely. So people generally older, it happens to people older in life, usually over 65. It does tend to run in families, so if you have a family history of it, you're more at risk. It does tend to be more severe in African Americans as well.
Really? So is that more of the hereditary kind of field too? There you're just seeing it more?
Correct, and it's just studies have been shown that it tends to be more severe.
If we know that mom or dad has had it, or grandma, I mean, do we need to really be making sure that we're getting checked for it?
If you know that you have a family history, especially if someone's gone blind from glaucoma already, you should be coming in around 40, 45 to get eye exams at age 45.
This is so important, as we've mentioned before, that you have a good team that can really understand what this disease, or I mean, is it a disease?
Oh, absolutely.
You know, what it can do, why it's important to catch it early. I know you're so proud to have her as part of your team as well.
Yes, I mean, we've done a lot of research, a lot of developments in cataract surgery, as well as seeing tons of patients with glaucoma. So bringing Dr. S along has really brought Newsom Eye to a new level. And I think not only our practice, but I think the Tampa Bay area, having somebody with her skill and her expertise, we've really been needing and wanting someone like her for quite a while. So she's a big addition not only to Newsom Eye, but the whole community.
I'm going to put you on the spot. I'm kind of just interested to know, are we any closer to finding what causes it or finding a cure? I mean, obviously that's got to be the goal at some point.
Yeah, there's a lot of studies looking into that, obviously. We know a lot of different factors that can cause it and a lot of risk factors, but no, there's still no cure.
Does it fascinate you as a doctor who's having to do surgery?
Yeah, absolutely. You know, the good thing is we have a lot of different treatment options now. You know, back in the day, we only had drops really, or, you know, and then the next step was a really severe surgery, and that was it. But now we have drops, a gentle outpatient laser treatment, a surgery you can combine with cataract surgery, and we still have
we're moving in the right direction.
Yeah, absolutely.
Well, if someone has questions, they want to find out more, I love that you're so open with saying, hey, give us a call, right? I mean, that's kind of the first step.
Absolutely.
And again, 3 locations here in the Bay Area, and you can have Newsom Eyes, as we like to say as well. This is just one of the many things that you guys treat. But thank you so much for being here. We appreciate it.
Thanks.
And of course, there is their phone number to call. Again, 3 locations here in the Bay Area, and they have a great website that can help answer a lot of questions as well. Thank you both so much. We look forward to having you back.
Thanks.
Thank you.